A UTI is a urinary tract infection, and this is an infection that involves any component of the urinary tract, including the kidneys, the ureters, which are the little tubes that drain the kidneys, the bladder, or the urethra. We most commonly use the term UTI synonymously with a bladder infection. For a recurrent UTI, we technically use the definition of 2 or more in the span of 6 months or 3 or more over 12 months. UTIs are very common, particularly amongst women. So an adult woman has a 50 to 60% chance of having at least one UTI over her lifetime. It's estimated that 1 to 7% of outpatient medical visits in the US are due to recurrent UTIs. For men, they absolutely develop UTIs as well, less commonly, but particularly with age as well, there is increasing risk. We were really interested in investigating the perceptions and the attitudes of women with recurrent UTIs. And we were inspired by seeing a lot of women who came to us very frustrated and feeling hopeless and helpless with not getting the help that they want to help manage their UTIs. We found that these women are very fearful and very frustrated. Fearful predominantly because of all the antibiotics that they've been receiving for treatment of their acute infections. Research has shown that even up to 40% of UTIs or bladder infections can be cleared with just symptomatic treatment alone. So taking urinary analgesics such as pyridium or azo, along with water, ibuprofen, Tylenol to help treat symptoms can oftentimes clear them. When they've looked at all the research, the one non-antibiotic prevention option that they found decent evidence in support of are cranberry supplements. So not cranberry juice, but actually the supplements really concentrate the active ingredient of the cranberry. One other great, actually evidence-based UTI prevention option that we do have for postmenopausal women is vaginal estrogen. I think also referring patients to specialists, of course, if they really are having, true bacteriuria or bacteria in the urine episodes, 3 or more per 12 months or 2 or more per 6 months, making sure that they're getting adequate evaluation. So sometimes we have to look at the anatomy with kidney ultrasound or CT scan, and then a cystoscopy where we take a little camera and look in the urethra and the bladder to rule out anatomic abnormalities. And then also with a specialist, they can really appreciate good counseling and kind of education, which I think is empowering and really helpful for women in these situations.